who do you go to trust for your information? If someone's trying, because in the social media world where it is chaotic and they don't know, and this is why I am eternally, genuinely grateful for you taking time to do this. Y'all are busy. You could be a lot of different places, but I do trust you. I do thank you for what you're doing, and I'm trying to help people develop that trust because I trust you. I know you. I want them to have the same thing. But if someone's still trying to figure that out, where do you go? What do you look at, or where do they gather that information from?
Yeah. So I think one of the best sources is the CDC's website, because the CDC has sort of two different tracks, one for healthcare professionals, providers, and one for common folks. Anybody can look at that information in simple terms, boiled down.
Right.
They have lots of the frequently asked questions. They track the Delta variant. You can see graphics like this. You can really see a broad section of information about just pregnancy or children or how the vaccines are made. All of that stuff is there, and the CDC folks are experts at what they do and helping communicate that out for us. So I think that's the top website I would put out there for people.
And John Hopkins COVID website is another one that's very user friendly.
Yeah.
You can track
Really
country,
cool
state.
graphic.
You can do parish, county in any state, and it will give you that data. It's CDC is easier to navigate than the John Hopkins, but they're both, they have no, horse in this race.
Yeah.
This is just straight data.
Yeah,
they're not massaging anything. This is straight data.
And
So
one
it's
thing
very
people
good.
ask me about all the time is, why is the World Health Organization different than CDC's recommendations? And they're dealing on a different scale.
Right.
CDC is taking in what we're learning from other countries, but they're looking at what's going on in our
America,
country and making recommendations. That's why the state of Louisiana will always follow CDC. So something may change on the World Health Organization level, but that may not be something that needs to change here. So
Right. They're looking at Sri Lanka,
right.
Ireland,
Yeah.
England, and trying to
Right.
compose. We're looking at
Overall,
the U.S. Yeah.